Okay. Well, today we have a short agenda. We have Sydney here to speak from the MIFMA, the Michigan Farmers Market Association, and she has some great information for us in regards to that. Um, so we'll start there with our phone call this morning. Thank you so much for joining us, Sydney.
Thank you for having me. I'm excited to talk about it today. All right. My name is Sydney Vivian. I'm the Food Access Coordinator with the Michigan Farmers Market Association. Um, I was asked today to speak a little bit about encouraging farmers markets to accept SNAP and double up food bucks, and some of the resources that MIFMA has to offer markets that are new to accepting those benefits. So for those of you who aren't familiar with our association, the Michigan Farmers Market Association is a statewide member-based nonprofit that works to advance farmers markets to create a thriving marketplace for local food and farm products. We place farmers markets at the forefront of the local food movement and work to ensure that all residents in Michigan have access to healthy, locally grown food, and that Michigan farmers markets and the farmers and vendors that sell those markets have policy support. So that's a little bit about us. And so when we talk to farmers markets about accepting SNAP, we like to say that it's a win-win-win for the market, for the community, and for the vendors that sell, because you're expanding food access in your community, you're increasing marketing opportunities for your farmers market and your vendors, you're expanding your customer base, and you're increasing sales at the market. So in Michigan, I will go all the way into our SNAP intro because I assume that this audience is pretty well familiar with that already. But in Michigan, in the month of December 2016, about 1.4 million people received $168 million in benefits. So we really feel that this is something that farmers markets can benefit from beginning to accept. In 2006, we had 3 out of 150 markets accepting SNAP in the state, and now in 2017 we have, I think, a little over 160 markets out of 300. So we're really excited about that growth, but we also know that there's still a significant opportunity to continue to increase food access through SNAP. Additionally, when a market begins to accept SNAP in the state, MIFMA is a great centralized resource for training materials, marketing materials, technical assistance. We also have a couple different programs that I will talk about a little bit more, and things like site visits. We'll go to a market, we'll see how they're doing accepting SNAP, give them any feedback or assistance that they might need there. We have an Accepting SNAP resource manual called Accepting SNAP Bridge Cards at Michigan Farmers Markets. It was updated in 2016. It's a comprehensive guide for farmers markets beginning to accept SNAP Bridge Cards in Michigan. It's available free to MIFMA members through the member portal, but you can also purchase it online from our MIFMA store, either as a digital download or as a hard copy. And kind of going along with that resource manual, we have a webinar that we put out do every year. This year, we hosted it on February 21st, and it's been recorded and posted on our website under resources and the webinars section, and that's called Accepting SNAP Bridge Cards at Farmers Markets. and it goes over all of the steps that you need to take to get started with accepting SNAP, as well as information about federal funding to receive equipment to accept SNAP at their market. So things like filling out the application, how to set up an alternative redemption system at your market, record keeping, all of the kind of nuts and bolts of accepting SNAP at your market. We go over and provide assistance with. We also have our market manager mentorship program, where we pair market managers that are new to accepting SNAP or new to their market that accept SNAP with market managers that are that have experience, and we think that's a really great program because you can network manager to manager and really get a lot of one-on-one assistance when it comes to implementing this program at your market. We have a product eligibility guide that's available to MIFMA members as an easy print, easy downloadable PDF, where we list, it's a little table, and we have SNAP, Double Up Food Bucks, WIC Project Fresh, Senior Project Fresh / Market Fresh, and Who Passes for Health. And then we have all of the food categories listed as well, and which benefits can be used to purchase which food category. And that's something, if people are interested in, I'd be happy to send an example of to Lindsay. Actually, anything that people are interested in learning more about, seeing examples of, I would be happy to send out after the call. And finally, in terms of upcoming events, we're going to be hosting 2 tours to give market managers and community partners an opportunity to observe and learn firsthand how accepting SNAP benefits can work in a farmers market setting. They'll be held at the Ypsilanti Farmers Market on June 20th from 6 to 7 p.m. and the Boyne City Farmers Market on July 15th from 10 to 11 a.m. And more information about those can be found on our website under events, or again, I'm happy to send more detailed information after the call. So that's what I have, and I'm not sure if there's time for questions, but I'd be happy to answer any if people have any questions.
There is certainly time for questions. Give me one moment while I unmute everybody.
Great.
There we go. Everybody should be unmuted now. Are there any questions about MIFMA or anything that Sydney just discussed? I have some questions. So my first one is, I didn't catch that date for the Boyne City tour.
Sure. That's July 15th from 10 to 11.
So you have 2 of these scheduled for this year. Is it expected that you might have any more scheduled?
I think that if we had more interest, we would certainly like to schedule more.
Okay.
In the past, we've typically done 2 tours, and haven't really received more requests to do them. But
okay. My other question is, I've spoken with a market once, and I couldn't tell you where it was. It was in a rural area, and they told me that they discontinued participating with the bridge card because of such low participation. And that would have been a few years ago. So what kind of response would you tell a market today had they said, a few years ago we had really low participation rate?
That's a really good question. I think we're starting to see that happen a little bit more. Um, and I think what I would probably ask is, was was it really the low participation rate, or was it, the cost of the equipment or something like that that you couldn't justify because of low participation? Um, because now we have a couple more resources for markets who are looking for something other than a hardwired point of sale device, um, and where they wouldn't necessarily have to pay the full cost of a device that wasn't provided by the state EBT contractor. Um, and and also, I guess I would say as well, to that market that, when they start SNAP again, it will probably, the first year that a market accepts SNAP, it's a fairly low turnout because people don't know that the program is at their market, and to expect that to increase over the years. And, a lot of markets in rural areas we have don't get a huge volume of SNAP customers, but that part of their mission of the market is to provide healthy, locally sourced foods to their community. And so I would say that, this is one way to make sure that everyone in your community has a chance to do that.
Thank you.
Mm-hmm.
Did anybody else have any other questions?
No.
So I want to thank you, Sydney. You had mentioned SNAP, of course, which we is one of our main prerogatives, our main goals to have the 16 over population connected with the SNAP benefit. You also mentioned Double Up Food Bucks and Project Fresh. And on last month's conference call, we had just spoken with we had just heard all about Project Fresh, and we quite frequently we have Double Up Food Bucks on to talk about their program. So these are all, fresh food initiatives that all kind of have to do with low income, and we're here to help low income seniors. So I'm trying to connect the dots. We want to make sure that we're encouraging our seniors to visit these farmers markets, and in addition, making sure that our farmers markets are participating. So if they hear from you, or if they hear from those seniors that they would like to be able to use their bridge card there, then they're more likely to sign up. And these are some great resources to share with our farmers markets if they're not participating in the SNAP acceptance at the market. So thank you so much.
Yeah, thank you for having me. I'm always happy to give people resources.
All right. Well, if there's no other questions, I'm going to move on to our next. Oh, I forgot to mention, I did leave the MIFMA website on the agenda. So just to reiterate, it is mifma.org. And I know Sydney referenced it a few times, but the link to it is on the agenda. Now I will move forward to our next item, DHHS heat and eat correction. Some of our individuals, some of our seniors that we've helped to apply, that we help to obtain the bridge card, were affected by the heat and eat provision back in 2014. Some of them lost a lot of food benefit as a result of that. They lost the heat and utility standard allowance. And we talk about this a lot. This has to do with the importance of the home heating credit. Those individuals who lost that heat and utility standard back in 2014 due to this specific policy change that has to do with heat and eat may have lost benefits too early. Because of that, DHHS is working to send over 12,000 individuals a letter in the mail, and it tells them that if they currently have an active bridge card, they're basically putting a lump sum of money back on their bridge card for food benefits. And the letter also states the period of time in which they lost those benefits. So again, they had reduced the benefits too soon for some individuals. Most of the individuals affected by this are those who live in subsidized houses with heat rolled up into the rent specifically. So those that have their heating costs rolled up into their rent are a majority of the individuals who are affected. Different individuals have a different time range that this repayment affected. Each case is unique. This does not mean that those individuals will have the heat and utility standard today. Many of them don't. There is another group of individuals who do not currently receive bridge card benefits. So either they got cut off or they didn't do the redetermination. For whatever reason, they don't have benefits today, but they're still due some back benefits from 2014. They will receive a different letter in the mail, and I don't have a timeline for that one. The first letter they're trying to get out by the first week of April. The second letter they didn't provide a timeline for. The second letter is for those who are not currently receiving benefits. And the letter has some specific instructions in it for them to contact DHHS and some information that they're asking to provide because those will be handled a little differently because they don't have benefits. The letter also does not promise that they will get repaid a benefit. It just says you might be eligible for some benefit. Please contact this number and provide this information to see if you're eligible. We're in the process of working with the HHS to see if there's anything further that we can do on our end about this, but I wanted to make sure that you were aware of it because the letters are already beginning to go out. Are there any questions on that? I know it's really kind of confusing and I tried really hard to make it clear. So, and I will be sending out an email as well. I'm going to try to get that out today.
Okay.
Any questions?
No.
No.
Okay.
It's my first hearing of it, so I'm kind of shocked.
Yeah, actually, I got a call from one of our sites the other day that heard some strange rumor. So if we start to hear, it's interesting how communication happens. It gets really broken down as people share the story. So if you start to hear from some individuals that they're getting this money on their card, it likely has to do with this. So.
Well, I know a lot of people were confused about the fugitive felon, thinking, they were going to get benefits, but okay.
Yeah, that's been going on for a while now, and I don't have an up-to-date status on that. Okay, so I wanted to keep this call kind of short and sweet today because that bit is so important and so complex. I hope I made it rather simple. But I wanted to make sure that we all, kind of walked away from the call today understanding that because I think it's gonna, I want to make sure that we all understand it. So Moving on, upcoming trainings. So we have a training in Kalamazoo on March 22nd where we try to reach most of southwestern Michigan. We have upcoming trainings in Wayne County at Wayne Metro. Those are March 29th, April 12th, and April 26th. There we will be rolling out our new coordinated questionnaire for the Wayne, the Detroit region, basically, the southeastern Michigan region. So keep your eye out for more information in your region if you're not in that one, because we will be expanding this slowly. We're kind of taking it one step at a time to make sure that we can get it all out the way that it needs to go out properly. But if you do want to attend any of those trainings, you can call our call center or your liaison, or even just email them and let them know that you're interested in one of those trainings. Our call center is available Monday through Thursday, 9 to 3 at 8. See, I don't want to give the wrong number. 877-664-2233. And last, I'm going to open it up to you for any organizational updates at your organization, especially if you have any upcoming senior fairs or events or anything like that.
This is Nick in the Lansing office.
Hi, Nick.
I'm doing a benefit enrollment event at Eastside Senior Center in Flint on the 22nd. So myself and some staff from our office will be going to assist clients who have made appointments for the day to get several people taken care of all at once. So if you are interested in having something like that at your organization, please feel free to reach out to us and let us know.
Thank you, Nick. We're actually in the process of scheduling one of those in Alcona as well, in partnership with Region 9 Area Agency on Aging. Was there any other updates? All right. Well, thank you, MiCAFE Network, for your time today. Have a wonderful week.